Across Minnesota tonight, healthcare providers say fear of ICE enforcement is causing patients to miss appointments, including routine and critical care.
Brittany Erman's live in Minneapolis right now with what clinics are seeing these days. Brittany?
Well, Kevin and Lindsay, healthcare workers tell me hundreds of people are not showing up for their appointments in fear they'll be detained by ICE. We heard from community leaders who say fear is now impacting health. Somali community leaders say fear is changing daily life, and now it's keeping people from getting the health care that they need.
The interesting thing is that a lot of those people who are afraid are also citizens or legal residents, but they're afraid of being taken.
Abdurazak Bihi says people are not showing up for appointments in fear they'll be detained by ICE.
There are people who are struggling with multiple issues such as diabetes, heart issues, or maybe kidney issues that need continuous care. I'm worried about those people.
Healthcare officials say it's too soon to quantify the problem in Minnesota over the last 2 months. But a survey by the Physicians for Human Rights and Migrant Clinicians Network found since January of last year, when the president stepped up immigration enforcement, 84% of nearly 700 healthcare providers across 30 states reported moderate or significant decreases in patient care.
There are entities where they are seeing the rates of the no-show as high as like a 50%. So that's huge.
Dr. Rolly Dovedi, a family physician and U of M associate professor, says from acute care to chronic illness, patients are suffering in silence. She tells us surgeries are being postponed and preventative care appointments are being canceled. So now providers are trying to adapt.
So how do you expand the definition of care and make it easier for people to seek care? Those are a couple of the things that we have been thinking and other healthcare systems have been thinking as well.
But she explained those solutions require time and significant resources. In the meantime, leaders say they're doing their best to advocate for their community.
If the society or the community are not healthy, there's nothing else that will work.
And healthcare leaders tell me it's likely we're not seeing the full scope of the impact, and this is just the beginning. The doctor you just heard from told me that it's likely emergency rooms will become overwhelmed as people delay critical health care. Live in Minneapolis, Brittany Erman, 5 Eyewitness News.